Hello. Today I'd like you to meet one of our best-selling patients, I would say. Now, one of our patients here in PINS, Philippine Institute of Naturopathic Sciences, BioCel Therapy Treatments, where we have what I would call a miraculous healing. And I would not like to preempt Dr. Almonte. I'd like him to tell us the story of how he went from a very what would be the word, Doc? Very life-threatening condition to one where he is now in good, great health. Here's Dr. Almonte.
Hi, good day. I'm a, I'm a physician. I'm 52 years old. I've been diagnosed with several disease entities. This condition actually happened a year ago. It started as low back pain and then got gradually increasing the intensity of pain up to the level that I could not walk, I could not urinate, and the initial diagnosis is swelling of cauda equina. So I've been hospitalized then for almost 3 weeks time, and then several medicine was given to me, injection and oral. But after 6 weeks time, several diseases also comes up. The most threatening is the reactivation of hepatitis B. And the laboratory tells us that the viral load test is almost 21 million. So, and another disease that comes up is diabetes, increased blood sugar, increased triglycerides and everything because of medicine that I have been taking up. So, there is a continuous medication coming from my physician, several physicians, and even they could not tell me what is the diagnosis. Actually, they subjected me for several bone biopsy and CSF analysis, but the diagnosis is still negative for malignancy, virus, or bacteria. They are really worried where my disease comes. And then my second admission is they operated me. And then after my operation, they subjected me to radiotherapy on my back, T11, T12, and the whole pelvic area, which causes me severe something like gastrointestinal irritation. And I can hardly walk by then. By the way, after that, we continue our medicine, they continue the medicine, and Dr. Micaliar introduced me to subject myself for stem cell. And I'm a little bit, there is some apprehension in my mind regarding the stem cell because I know the other method, the way they do the stem cell. So one of my friends invited me to go to China for another therapy. But doctors in China said, most of them suggested that I should undergo chemical therapy or chemotherapy. I refused and I come back here in Manila, and then just after a few days we go to Dr. Micaliar's clinic for stem cell therapy. And the very first manifestation of stem cells, right after the injection, I feel much better. It's almost 50% weight, the strength recovery is almost 50%. I was able to walk, I was able to raise my legs without any cane. And then continuously, and then last December, by the way, After 3 months of stem cell therapy, the viral load, the DNA viral load, which is 21 million, goes to 9,000 only. So my hepatologist is really, really amazed of what is happening on my body. And I did not tell that I was with the stem cell. I just tell my doctor last February that I was in stem cell therapy, and he believes also.
Good.
And next is the next benefit, major benefit that I've been experiencing after 6 months is my gastrointestinal movement is well good right now. I don't have something like I can control right now to poo. Before I could not,
As a result of the
as a
radiation.
result of the radiation. Another is, last December, I was again admitted in a hospital for almost 1 month with the diagnosis of, they are saying that it's a stage 4 cancer of the lungs.
Mm-hmm.
They do everything in my lungs, they do bronchoscopy and everything, but I believe that, continuous stem cell therapy will shrink that.
Mm-hmm.
And when they do bronchoscopy, they could not find any single mass in my lungs.
But you were hospitalized because you were coughing and coughing.
I was hospitalized because of fever.
Fever.
High
Yes.
grade fever.
Doc, when did you find out that there was a mass in your lungs?
When we were in China.
So that was long before. So
Something like
October, and then by December they did the
bronchoscopy.
bronchoscopy. It was gone already. So in 3 months, something that was supposed to be stage 4 cancer disappeared.
Disappeared.
Wow. Okay. But
And
Doc,
this is backed up by X-ray and CT scan.
yes, it's really great.
Yeah.
Doc, tell us about your bone healing, because I think it started.
Yeah,
The test started in your bones.
My experience is probably without the stem cell, the bone healing after radiotherapy will be prolonged.
Mm-hmm.
It will took my bone around a year before it heals. But right now,
It's healed.
I don't feel anything with regards to that.
That's so great. So, on a general conclusion, what do you think about our BioCel therapy?
BioCell therapy is so unique, so amazing, so wonderful. Because, in my reading, the difference of this technique is the 7 ingredient in the BioCell.
Added to the
in the
stem
stem cell.
Yes.
This will increase and prolong the action of stem cell, and and this is done every week.
Yes.
I don't believe on this stem cell that 1 or 2 injection you'll be well. There's no such thing as that. There's no such magic. Because healing takes place.
Yes.
So that's the wonder of this. This is continuous. Every week you have to subject yourself for injection for bio-stem cell. Because every week, it's not just a magic that when you inject stem cell, everything will be fine.
Mm-hmm.
So here, it's something like gradual but sure.
Yeah, that's nice. So you would say that your general well-being is now like before you got sick, or better even?
Before I'm sick, I'm around roughly 68 to 70 kilograms.
Mm-hmm.
But with the prolonged sickness, last December when I was discharged January, I am only 41 kilograms.
Wow, you lost a lot.
But without the stem cell therapy, which commenced last October, started last October 2015 without the stem cell therapy, I don't think so I will survive. That condition, the December 2015 admission.
So,
Even in the hospital, I was continuously
given
given the stem cell therapy.
secretly.
Secretly.
We do know that some doctors don't believe in this, but it was also a medical doctor that was administering it to another medical doctor who agreed. So,
Because you know, I'm not against chemical therapy or chemotherapy, but everybody knows that subjecting yourself to chemical therapy is just killing every cells in your body.
yes,
This is different. This is not killing, but this is healing as well as creating new
New
cells.
perfect. Doc, did you experience any improvements, let's say, in your skin, in your eyes, in your stamina,
Yeah, I'm 52
everything?
years old and I
Yeah.
don't wear.
Glasses.
I'm still wearing the glasses way back before, and I was given a stem cell.
Okay, so did
So my skin is, you know, I don't look at my skin.
Mhm.
I just always, I don't look at my feature, but I usually look at the blood analysis,
Mm.
if it is normal or not, because I'm after. You know,
And you're a
recovery.
doctor. So you would say that your blood analysis now is all normal?
Yes, all normal. Up to now, the SGPT, SGOT, alkaline phosphatase is always very, very normal.
And that was your concern before?
Yes, my liver.
Okay.
My diabetes, the way is they're telling me my doctor does not consider me as a diabetic person because during morning it is just 8,
Mm.
87, 80, 90, so random blood sugar. But it usually goes around to 130, 140, 150 after eating lunch, which is something like pretty normal.
Yeah. So, would you recommend this, Doc?
I would not just recommend, but I'm boldly talking to several persons, several patients also. By the way, I'm doing rehabilitation therapy, and we know each other, and they know me already, and then I'm really recommending them that, you know, if you just have the money, just subject yourself to stem cell therapy. Not just an stem cell therapy, which you know, in every corner of the street,
Yes.
but
That's why we call it BioCel.
I will tell you where you have to go.
So, that's it from a miraculous cure. I would really think it's a miraculous cure, Doc. So, thank you so much.
Thank you, thank you.